In the first video that Libs of TikTok made go viral on Twitter, a doctor at Boston Children's Gender Clinic says that they treat, quote unquote, treat children, help them transition, trans them as young as 2 and 3 years old.
So most of the patients that we have in the GEMS clinic actually know their gender, usually around the age of puberty, but a good portion of children do know as early as seemingly from the womb, and they will usually express their gender identity as very young children, some as soon as they can talk. They might say phrases such as I'm a girl, or I'm a boy, or I'm going to be a woman, or I'm going to be a mom. Kids know very, very early. So in the GEMS clinic we see a variety of young children all the way down to ages 2 and 3, and usually up to the ages of 9. When they come into the clinic, they'll see one of our psychologists, and we'll be talking to them about their gender. We'll be talking to their family about how to best support that child and how to make sure that that child has the space and support to explore their gender and do well throughout their development. And we'll be answering any parent questions. A lot of parents do have questions, and so we answer those questions. The biggest piece of advice I give parents who are coming through the gender clinic at Boston Children's Hospital is to just be supportive. Sometimes you might not understand, sometimes you feel like you don't know the terms, or you don't kind of get exactly what the child means when they say that they might be this gender, but the biggest thing you can do is just love your child and support them and just allow them to express themselves. That's the biggest protector as well against negative mental health effects such as depression, suicidality, anxiety that we worry about for our gender diverse kids and young adults. So that support from a parent is one of the best protective factors and one of the best things they can do.
I remember once reading that the devil isn't a hideous beast with horns on his head and warts all over his body. That the devil is actually the most attractive being that you could possibly imagine. Sexy, handsome, tempting. Because otherwise, if the devil wasn't attractive and wasn't appealing, everyone would reject the hideous beast. And when I see a video like that, that's what I think of. This is evil packaged as love. But really, it's the opposite of love. I mean, when you talk about 2-year-olds and 3-year-olds and 9-year-olds in these gender clinics, it's not even a matter of, oh, children are children, and because they're children, they can't consent to bodily mutilation, and parents shouldn't be allowed to inflict this on their children. First of all, there's no such thing as being transgender. There is gender dysphoria. It's a psychiatric diagnosis. But mutilating your body does not turn you into the opposite gender. So this is not even a matter of children being unable to consent to this and parents abusing their dominion over their children to quote unquote consent on their behalf. What we heard in this video is emotional blackmail. Telling parents that if they don't cooperate with the gender clinic, with this ideology, that it's going to be their fault when their children commit suicide. There's no other medical treatment that is built on this same evil justification. And what's going to happen is parents are going to end up fearing taking their children to any kind of doctor, because what this woman in this video is doing is creating a situation where the parent is looked at as being abusive if they don't cooperate with transing their child. If your lack of support, as she created this premise, if a parent's lack of support causes a child to commit suicide, then that parent not cooperating with transing their child will very easily be painted as being abusive. And what happens when a parent is abusing their child is that justifies the state stepping in to investigate and possibly seizing custody of that child. And so what's going to inevitably happen is parents are going to fear taking their kid to any doctor, specifically if their child has a mental health issue, because the medical industry is painting dissenting parents, parents who believe in biology and science, as being abusive parents, which could lead to the parents losing their children to these radical leftists.